be that shouldn't go union. I'm trying to get the perfect language.
Yes.
If there's a sector that should not go pick up arms, I think it's health sector. Health sector is the life of a nation. We can't afford to play politics with the health of our country, sir.
Yes, sir.
What is your view on this?
Simple. Let me start with the ECOWAS and whatsoever. ECOWAS nations are independent nations. The West African nations extremely backward economic-wise. A backward nation shares nothing. They are giving all they needed to share, inclusive Nigeria. May I say this for the sake of the people at home and everybody? Strike is not an endemic to the health sector. In Israel, 2011 precisely, they were on 130 days. The doctors, yes, in Israel, you can Google it, you'll see it. And it was reported in Lancet. And what were they asking for? Money, capitalism, raw money. It's not even this organizational deliberate defect. So in Germany, 2010, they were on strike. In South Africa, 2010, it required them mobilizing police, everything, which they had in reserve. But eventually, the government had to answer them. In Britain, in 75, okay. In 2012, they were on strike. In US, they were on strike in 1975. And there's no basis for an American doctor to go on strike, for God's sake. You are going to look funny. A neurosurgeon in America, with all the compliments and everything he has, earns a $400,000 per annum. And that's more than yes.
Let me say this. Let me say this.
Yes.
We have heard stories in this country. You and I live in this country, good enough, where people who work in the health sector do away with drugs provided by the government. I don't know if you're aware of this. Are you aware of this?
I wouldn't say the health sector is isolated from endemic pandemic corruption. And the only person that instituted it is government.
Blame government.
No, you blame the government.
That's the
Wait, you blame the government for stealing the drugs
the people's decision?
Yes, I'm going to explain. Let me tell you, one of the demands of this strike is creation of National Residency Board. Currently, doctors are unemployed in Nigeria, and Nigeria has doctor equivalent of New York. The whole doctor Nigeria ever produced is not up to the doctor in New York, but the unemployment of doctor. I'm a resident doctor. People want to come into residency. We say things like, now, whether you know anybody in Abuja or not, your child will go for NYC because there is a structure. We say create a structure. But what the government is doing is this. Because, look, there's huge phenomenal corruption going on. And the trade word that always, the money is not enough, it's not true. There's abundance of money. And why am I blaming the government? In National Health Scheme in UK, government buys the drugs, provide how the system is monitored, and hold people accountable. Have you seen a government arrest anybody for something getting lost? If small thing is lost, that person will be punished. But if big thing is lost, that person gets promoted in Nigeria.
Now, should the government arrest people every day? Is the government supposed to be arresting people every day for stealing drugs?
In fact, for blinking your eyes against the light, a red light, you should be punished.
Okay, so the doctors who are also accused of diverting some of these things provided by government to private practices should also be arrested.
That is, in fact, in most cases, aside from being doctor, so most of those diversion people are always saying are spurious. Can I explain?
They are spurious.
Yes, because you see, people are not aware of how the mechanisms of the health sector. As a consultant, you have rights to private patients.
Okay.
In Nigeria model, they said any patient registered in government hospital must not be found in your hospital. And there are mechanisms of assessing that. Now, if a patient thinks he or she has been diverted, he has the right to report to Medical and Dental Council, and the doctor will be ably punished. If a doctor is not up to 10 years and is not a consultant, he cannot have a private practice. He can work under an individual to have a private practice. Now, what do people call diversion? You see the well-fed man. He comes to the government hospital that government deliberately make inefficient.
That's the question he
asked. Government deliberately
because they provide the drugs.
That's
what he asked. By what means? By what?
Yes.
Break it down.
Yes.
How does government make their hospital inefficient?
Okay. By what means? The purpose of people that are listening is this. go to the National Health Scheme. Because why am I saying it? Service in UK. One of the best in return for money investment is the National Health Scheme. One of the worst health sector anybody can copy, whether under bourgeois economics, capital, anything, is the American health system. Wrong, defective, very hostile. Now we can use the template of this discussion as the National Health Scheme. There is, when a patient comes to accident emergency, and to the time it's operated, if it's surgery, there's a time. Why is the government not interested in this? Or is it me that will go and report that government, please, so you know, I think you should be interested in where you put your money. And in the health sector, the whole system is filled with that. Because when there is lawlessness, the only thing that appeals to everybody, anybody, is to be lawless.
Sir, let me say something on that. Government is supposed to believe in you to do the right thing as a consultant. Government is not supposed to be telling you what to do after we have recognized that you are a consultant, you are qualified to be there. Government shouldn't be giving you time again. This is how, no, I don't believe that personally. Except you are saying we are inefficient, we need the government to come with a cane and run us here. No. I think that, is that what you're trying to say?
What I'm telling you, why I used a specific thing, so that people, our listeners can go and look all over it, is that all over the world, they said animals or goat or anything that has a chain on the neck doesn't get lost. In Nigeria, you see what is pathetic in the health sector. Look, there is level of responsibility. Let me assure you now, why do things, take drugs, for example. We then go to how people divert people, everything. Drugs. The National Health Service buy their drugs in bulk. The drugs has number. All drugs that are coming to Nigeria has a number. And whoever is dispensing it has a number. I have a number. My number is 46,589. Okay. How did this drug get lost? Now, but because the government is so interested in the drugs getting lost first, because the reason is this. Let me just tell you. Okay. Some people are living on that drugs. Some people are living with it. That is the clear terminology. Okay. Like, how will you understand? Basically, what I'm saying is that in HIV, some people are living with HIV. Some people are living on it. Some people were based on HIV money and built houses. So, but some people are living with it. So the government are deliberately interested in the inefficiency to get more money.
I think I'm looking at this thing from the back side of it. Somebody is doing something wrongly. Yes. And you're not talking about that person. You are talking about the government who expects that person to do the right thing.
The number one law in science is you go from known to unknown. And the known is that an average person, they said absolute power corrupts absolutely. So the number one thing is that there must be checks and balances in everything. Now, who controls how this drug gets in? Let me tell you, very pathetic. What do all hospitals do in Nigeria? They will go and meet one friend that whether I donated money, when we campaigned, he brings in the drugs. People even go to China, go to India, they will tell them this drug that is 1 gram, please load it with 200 milligrams. And they bring it in. And then how did, in the first instance, the drug will get cleared? He comes to the hospital. Now there is no, have you seen prescription in Nigeria rights? None. In UK, there is across-the-counter drugs, and there's prescription drugs. So how will prescription drugs get lost if there is prescription right? So there must be, now look at here, sometimes ago, in this same country, you have had NTA closed by 4. But today now we watch things throughout. It's an improvement because some people decide to invest and improve. Why don't we sleep there and say we want to close at 4?
The question would now be, because of the decay in the medical institutions, because of the decadence, should you guys continue to go on strike?
Shut your doors.
Shut your doors.
In fact, that is the number one thing. Will you be surprised that police went on strike in Brazil? Police went on strike in Peru?
Did you also check the results of their striking?
Yes, the government had to step in.
No, before the government stepped in, did you check the amount, the increase in crime rate within the short period they were on strike?
Because the government then thought they are relevant. They had to do something. In UK, 2012, they were going on strike for pension. Pension. Because I tell people, they are living in heaven. And we here, we live in hell. Now, to come to heaven, you need to come to the earth, be born again, apology to the Muslim people, be born again, die, and then move to heaven or hell. Now, people in heaven are on strike for pension, for God's sake. Now, you are not worried that